Okay, before I start, I just want to ask you once again if you would like to pull in the questionnaires for it's a master's student and PhD student, and apparently you got confused about its exchanges, not servings. So if that can guide you in the answering of that. So how many of you work in private practice, just by raising your hand? Okay, and how many of you work in government institution? Okay, and how many of you work in institutions such as hospitals? Okay, okay. It's just a way of indication that we have a very balanced group of. So I don't really want to bore you with the subject, but I do think that it's really very important for you to understand where are we going in the next 3 cycle of policy development in this country. So first of all, we know that on average 1 in 9 of our world population suffer from hunger, but in sub-Saharan Africa we're really doing very badly. It is 1 in 4 people. And we do know that globally there is the capacity to in fact supply enough food for everyone. And that food insecurity predominantly has always been described as a rural problem, but more and more we see it as a peri-urban problem. And if we look at South Africa by itself, we know that we are experiencing rapid urbanization and acculturation, and that many of our policies are still aimed at the rural poor, but in fact that they're living in peri-urban areas, and that we have to wake up to that fact. That by 2030, 60% of the world population will be living in cities. Now, if the focus of today is on food security, but I've done this on nutrition as well, so maybe for another day. But if we look at food security, we have a serious problem here that the food indicators that we report food insecurity on, there is no consensus between researchers on that. And if we look at the advantages and disadvantages of each of these indicators, we can clearly see that there is no particular one single answer to measure this complexity of food insecurity. And if we look at recent studies that has been done in South Africa, you can see that there were different tools used in each of them. And that's why our data is not talking to each other. And we know, for instance, that the IES is done every 5 years. The sample sizes are quite large, 30,000 people. And the National Food Consumption Survey that was done in 2005, which was our only program ever to look at food utilization. And so we continue, and we know that the SAN Haines, we thought is absolutely fantastic. They only look at 12,000 people. And how reflective is that of our more than 15 million people living in this country? So we have, our main challenge is that we have no regulated way of monitoring food security. And that everyone uses different methodologies, we use different samples and sampling techniques, and that we assess different aspects of food security, and therefore we are bound to get different results. Remember, if you are working for government and you have to determine who will get a social grant, you really want that lowest figure. If you're a person that has a different perspective, that you have to look at coverage of vitamin A supplementation, you will measure it differently because you want as wide as coverage as possible. So this is also some of the reasons why there's no real consensus, because the outcomes are being used differently as well. So we have never had a national survey on to access food security, all the food security dimensions. So this is just a list of all the studies that I could pick up that has been done since 1995 up to recently. And you can see that everyone measures different things. So if we summarize it then over time, we can see, well, in fact, food security has increased. That is very good news. It doesn't matter which study you look at. We generally had an increase in food security. We generally had a decrease in people reporting that they're experiencing hunger. But food insecurity was measured in the Stats SA analysis as 21%. But we do know that government only say 12% of people are food insecure in this country. And but if you are experiencing hunger, 26%, are you food secure? You know, isn't that one really more speaking to the Stats SA value? So if we want to develop a good food security indicator for South Africa, it's important that it should be relevant, that it should be credible, but that it also should come at a low cost, because government are very scared of implementing more indicators that will be costly. And it must also show a time sensitivity. It must be appropriate for the decisions to be made. It must be across locations and cultures, and it has to be tested for validity in our local environment. And as we know, there's no global standard, in fact, exists at this stage. So, and why in the world have we not come to a global key indicator for food security? And I think that's one of the main things that was difficult for us to sort out as well, is are we reporting on a global level, or are we reporting at a national level? We know that South Africa is food, we like to say that we are able to produce enough food for everyone in the country. Is that what we consider as being food secure? But we know, so at a country level we're food secure, but at an individual and household level we are 26% insecure. So it's really very important to define exactly what you want to report on. So, so I thought I'll bring you some of the economic perspectives of how we look at consumers. And if we look at the class mobility in South Africa, we know that the poor is moving into the middle class. And that's a very positive thing, because mostly politicians like to have positive messages. What are we doing right? So the fact that LSM wants, which is mostly illiterate, that they are all moving out of that very low group into the higher groups, it's very positive. Some things we are doing right. And we know at this present time that at least 50% of our population is in the middle income group. So what does that marginalised group look like? We know that they spend 35% of their budget on food. We would like to have them, if they have grant, to spend 100% on food, but they don't. They buy cell phone time, it's really important. For them it's really important. They're away from their families. They are living in peri-urban areas. How will they know what is happening with grandma and the kids? So it's a real reality that they are not spending it only on food. We don't want them to spend it on alcohol, but they also do that. So by really trying to understand those consumers better, we can target messaging also better and policies. Our emerging consumers, we know that they spend 22% of their budget on food, and that they in fact are responsible for 50% 1% of our national food expenditure. And then our high income group, really, you know, we are complaining about the price of meat. I mean, really, it's so expensive. I have almost a heart attack every time I see, you know, per kilo. But can we really complain? Because we're only spending 7% of our budgets on food. So the nutrition transition story, we all aware of, and we are not really going to study it, but we know that we have this triple burden of disease, and how do we put policies in place to really address this? And if we look at our risk factors for death, we know it's quite clear that 8 of our 17 leading causes of death is because of what we eat. And so this is one of our newest little babies that I'm just showing you a glimpse of. But this is our COE project, where Nelia Steyn has done a review of the most recent studies in the past 10 years. And it includes both the peer studies in Northwest, as well as the Cape Town peer study, and then the KwaZulu-Natal rural area. So how representative of our country it is, we can question that, but I think it's a very interesting glimpse. What really struck me was the large variation in energy and macronutrient intake. And that if we look at the percentage energy from protein, it ranges between 11 to 17%. And be mindful, like Claire said this morning, 20% of our diet we say can come from protein. So we are not there yet. Fat, we know that FOs and SA reduce it to less than 30%. According to these studies, currently it is between 70 and 30, which we also know there's a wide variation in diets. But mostly in the large studies we found that we as a country are still eating below what is recommended by FAO. Or we're almost there, reaching it. And then carbohydrates, that may be where our culprit is. So, so there's a large variation in mean intakes, not only by location, so urban, rural is starting to disappear here, but also by the dietary methods used in the different studies. And there's large differences in the minimum and maximum values for the micronutrients found in the different studies. So you know what our typical diet looked like in 1999, and we know that it was a really bleak picture. And in the recent study in Limpopo, we can still see maize is right up there with the starchy food, highest intake at 7 days, reported frequency, but also, the next one, sugar. So we have to watch that out for that. And if we look at the staple food expenditure patterns of our different socioeconomic groups, you can see that, yes, if you have less than 140 Rand per household per month, your staple, 31% reported it to be maize porridge. But you can see how it moves up. Where our high income is mostly white bread and then brown bread. And then, interestingly, pasta and potatoes seems to not really be influenced by your socio-economic subgroup. Real interesting data. We have this now for all the food groups. So, but it's really kind of revealing how to target messaging. So if we look at processing, we know that most of the targeted, most of the current policies for agriculture is targeted own production. But see how little is in fact consumed, and how many people are in fact just buying food today. And if we look at the cost of the food basket, and this was a very rough norm that was used, it was in fact based, or it was developed to inform the basic wages salary. So it was really a rough estimate of what you need to buy a balanced diet for the different household incomes. And we can see that this is why we as consumers say, well, food prices in South Africa is just too high. We are not able to afford a balanced diet. But we also then need to recognize the fact that we have to regulate processed and unprocessed foods. So going back to the global picture of policies, we know that enshrined in the ICN2 is that the vision is to end all forms of malnutrition by reshaping our current food system to improve people's nutrition in a sustainable way. And, you know, if you come, I mean, I was in a meeting in Rome that they were, you know, we're still talking about the Millennium Development Goals. They just say they're gone. There's no talking about it anymore. So we're still digesting this one, you know, but they say, no, we've moved on. But how did we as a country compare to the other BRIC countries? And I just thought that you might find this interesting. So if we look at the other BRICS, we first of all have to recognize the sheer populations of the other BRIC countries. So just look at those values. They are really, I mean, India having 1198, you know, it's really amazing. Yet their life expectancy is much better than ours. So, so that what is marked in red is where we did not reach the Millennium Development Goals. So we have the second highest expenditure on health, but we have the lowest outcomes. So if we look at infant mortality, we are comparable to India, under 5 mortality. Adult mortality rates, we know, of course, we just say it's HIV and AIDS. But is that true? Maternal mortality, but we did not reach what we were supposed to. And then communicable diseases, we're also not where we are supposed to be. And we're really lagging way behind China and Russia. So with the prevalence of HIV, we know that we are still not really where we want to be, and that the prevalence of TB is of course extraordinarily high, and that tobacco smoking has really been successful, but we've not reached the Millennium Development Goal. But that's the only one that we can really be proud of compared to the other BRICS countries. At least some good news. So, I pressed the wrong button. Okay. So now we can play the blame game. So who's to blame? You know, and you know, people will say, well, you know, people don't exercise enough. It's a person, it's an individual. It's their fault. So we have to watch what we eat. It's the quantity and the quality of our diets that is wrong. It's what we are able to afford. It's urbanization. It's the LSM movement. We've not learned to make the right choices. In fact, you know, it's the fast food industry's fault. It's not our fault. It's the manufacturers. They provide the wrong foods, you know. It's the advertisers. It's the healthcare professionals that don't tell us these things. So, but we all have to have a level of responsibility. And so if we look at the post-2015 agenda, where are we going? We feel that 4, 5 and 6 just have to continue beyond 2015. And that we know that NCDs are really becoming prominent on the world agenda. And so the Sustainable Development Goals is these 17. And I think we're all going to learn them, you know, but nutrition is really quite prominent, and food security as well. So they mentioned in at least 4 or 5 of these goals. And the discussion at the moment is that most countries will not be able to report on all 17. And at country level, we probably will select those that are most important to us as an individual country, because all of them come at a cost to report on. So while our policy is important, we know that it directs the vision, the priorities, but also the budget and the course of action of a government. So this is what the policy alignment looks like. If you've never seen it before, we start off with the Constitution, and then we have the medium-term strategic framework, we have the outcomes, and we have the National Department Service level delivery agreements, we have strategic plans, policies, and programs and regulations. And most of us are working with the effects of these last ones, but they're all guided by what is going on at the top. So in the Constitution, it spells out the principles of what the country is ruled by, and we know that nutrition, in fact, is enshrined in our Constitution, and also the right to food. And then the National Development Plan, which is our vision to 2030, we know that this is the framework that will guide us during the 3 electoral presidential cycles for the medium-term strategic frameworks and the policies that comes from that. And it was guided by the 2010 diagnostic report that was saying, you know, the policies is not talking to each other, the different departments is not talking to each other, and therefore we have major challenges also to address. So a principal indicator of the National Development Plan is to eliminate income poverty. And in order to be able to do that, affordable access to quality health care and household food and nutrition security are listed as milestones. And so in the medium-term strategic framework, we can see that food security and land reform is one of the major aims. And the new framework have 14, for 2014 to 2019, have 14 national outcomes, and 2 of those outcomes are directly linked to nutrition and food security. So if you try to map food security, Professor Victor Haase tried that, and you can see that it is linkages that's really very difficult to express. And therefore it's so difficult to have a single outcome, because you have so many departments and ministries involved in that. So maybe it's easier to look at the supply chain side, you know, maybe that will be easier. But I've just put up red meat supply. You can just see it's so complex, you know, there's something like 148 regulations just for the meat supply part of it. So, but what we do know that the provision of energy without adequate intake of critical nutrients is where our main focus should be. So we should focus on having enough vitamin A, iron and zinc, and probably also on protein in the diets that we are providing. So we need to shift from quantity to quality. And where all agricultural production has always been on the amount of food that you're able to raise per hectare and report it on per energy, we should look at more of the key nutrients to say how much vitamin A we have produced, and how much iron, and how much zinc, and how much protein, rather than mere calories or kilojoules. I hate the calories, but that's still reported calories within the urine system, so we can't change that. So if we look at the alignment for policies as signed for food security, you can see that there are many departments involved, and it includes the revenue, where we have the zero exemption of basic foodstuffs, to a Department of Education, basic education, social development, land reform, DAF, and Department of Health. And we also know that food security has been included in the mandate of multiple sectors since 1994. if we think about the Zero Hunger program, and that's one of the programs that has been miserably not really well promoted and then stopped. But some of these are still going on. But the main focus of the Zero Hunger program is that it was not well funded. And so the food security at the moment is the responsibility of both DAFF and the DSD. And in the new policy framework, we have then the new policy, the Food and Nutrition Security Policy for South Africa, which is both the responsibility of social development and DAFF. And you can see how many of, you can see how many, Department of Health is putting in on NCDs, on maternal, neonatal and women's health, roadmap to nutrition and obesity, and also strategic plans for the NCDs. But the main focus of food security falls within this policy. And the policy aims to target the threats towards food and nutrition security. It includes globalization, international trade regimes, climate change, storage and distribution of foods. And the alignment from the government level is that there will be a national coordination unit, both a National Food Security Forum that goes down to provincial, district and local. And it will then be guided by the core department, which is listed here. And when we analysed all these policies for the Standing Committee of the SCN2 last year in Rome, we can see that our new policy, in fact, is able to tick off, to tick off more of the boxes, which is the guiding principle on programming for nutrition. So looking at agriculture, how much they deliver on the nutrition outcomes. And but that we still have some way to go, because we don't look at nutrient-rich foods, we don't look at diversification, we don't look at the nutritional value, and also how to retain those nutrients once we store them. So these are something that government is really listening to and trying to build into the new policies and programs. So in summary then, although I have not really talked about nutrition, we know that we don't have for nutrition a single indicator or a consensus on which nutrition indicators should be included. We only have two at the moment, two questions that are being asked about nutrition in terms of hunger in different ways. And then food security as well. They use income as a proxy, and we know what are all those limitations. So we need to have better reporting indicators to be able to say, well, we are improving the situation, or are we not. So in conclusion, we would like to redirect nutrition transition, but we need a collective vision. We need champions for nutrition and food security, and we need them at all levels. We need them at local level, at district level, provincial level, and at national level. And policies should be of a high priority, and I think that is what government is saying with the food and nutrition security policy. And then we need the scientific evidence, the technical expertise, and we need correct monitoring and evaluation. So in order to have a healthy nation. And with that, I would like to thank you.